For the first time in over 50 years, the White House held a conference on hunger, nutrition, and health, with the goal of ending hunger and increasing healthy eating and physical activity by 2030, so that fewer Americans experience diet-related disease while reducing the related health disparities.
There are some folks in the room here that are going to be our panelists, so that were at the White House conference yesterday, myself included. And so I just want to say that having been alive, because half the room had not been alive in 1969, which was awesome, which was to have many, many, many young people and the next generation of leaders. But one of the themes that was so missing there and has evolved and was very present was the input of those with lived experience. And that has been something that has been gaining importance, and for legislators and for decision makers to listen and learn, but more importantly, to have the individuals with lived experience actually in the dialogue regarding the policies. And so that was just very evident yesterday. And I know we talked about that. And so today, what we want to know from you is to hear a little bit about your story, about your lived experience, and we're going to start there. So welcome.
Thank you. For those of you who don't know, my name is Dawnette McManus. Can everybody hear me? Can everybody hear me? Okay. On July 26, 2019, I became a mother of 3, from a mother of 1 to a mother of 3. My sister passed away 5 days after giving birth to a baby. And so my entire world shifted at that particular point, and I had to figure out for my family and for myself how I was going to manage this larger family, their nutritional needs, and make things work on a tight budget, on a shoestring budget. And many parents who know this story, we can substitute the name Dawnette McManus for a lot of parents who are trying to do the same thing that I did. So that pretty much, I don't want to get into long details, but my sister passed away. I now am the proud mom of 3 daughters and 1 son.
So that catapulted, well, go ahead, please. Yeah, that catapulted you into a much different situation. You didn't anticipate it, you had to figure it out, and in such, have there been experiences around access to food that you've had, both either positive or negative? Is there anything about the access to food that you could share with the audience today about how to make that better?
Okay, well, I think I'll jump in a barrier. So I earned my, sorry, I'm not used to speaking on a microphone. I earned my bachelor's degree. I did what I was supposed to do. I went on to earn my master's degree. I was on my way. I decided that I wanted to do great things, and I'm still doing great things. But one of the things that was a barrier was that I earned income. And so when I tried to access resources because of my new situation, the barrier was you make too much money, or you're not eligible. And I've been hearing that for the last 3 years that I've been raising these 4 children. So making resources available, like the Greater Food Bank, yep. the Greater Boston Food Bank, and Catholic charities and food pantries all around have afforded me the opportunity to provide nutritious meals for my family. My girls only eat fresh fruits and vegetables. They don't eat anything that comes out of a can.
That's good. That's awesome.
So
making it more accessible, right? Because
yes.
that income limitation is something we hear a great deal about. Because you can be like, I'll give an extreme, $1 over, and you're out.
Yes.
Right. There's not a flexibility there, and I know that that's of interest to many policymakers. And these are federal programs which are challenging in our state. We don't control them, but there are many other state things. So to close up, first of all, thank you, because I think it's important for us to understand stories and to understand how folks find themselves, because the situations they vary, though they are deep and powerful. So thank you for that. So here's my last question for you. And this was a question asked to many people yesterday, was, okay, you rule the universe and the food access. What would be one thing that you want our policymakers here today to hear, and the policymakers in Washington, and in particular the Biden-Harris administration?
I want them to start early as possible. We have all of these programs that provide vouchers to families at daycares. Why not offer a farmer's market at the daycare, at your point where you're dropping off your child? Offer on the website for SNAP, there's a coloring picture of apples because it's the season. Start now when they're 4, 5, 3, however young they are, and get families involved. If they don't know where the food comes from, then they can't do all of these nutritious things that they'll pick the thing that costs 29 cents, ramen noodles, okay? 29 cents a package of ramen noodles. It has 830 grams of sodium in a package of ramen noodles. That's 29 cents. An apple costs 99 cents. Why is that? And how can we, the Biden administration, legislature, change that? In urban communities, there are corner stores where you can pick up these items. You can get I don't want to go into brands, but you can get a 16-ounce can of sugar. But if you wanted to get a cranberry juice, which has about 9 grams of sugar, you're paying twice the amount for something like that. So that's where I believe we start.
Awesome. As you can see, the voice matters. Thank you so much for your story. I'm going to close this and now send it back to Catherine and ask our panelists to come up.
So let's get into the conversation. You're all working within the food access space, but bring very different perspectives to the table. Some of you were even at the conference yesterday. I want each of you to speak on the lens that you're bringing today to this conversation and what you hope to get out of this discussion and the days ahead.
Good afternoon, everybody. And thank you for your courage in telling your story. Because one of the things I want to get out of today is, as a social worker, you learn to listen. And if I've done nothing else as Secretary of Health and Human Services over the past almost 8 years, it's I have really big ears. And you need to keep your ears to the ground to hear people's truths. Yesterday, so I was not in Washington, but I was on the phone with my colleagues in the state of Oregon with the Center for Medicaid and Medicare Services. And some of you may have seen the news that the Commonwealth received approval for what's called a Medicaid waiver, which is worth $67 billion to the Commonwealth over the next 5 years, starting on October 1st. And you could say, well, that's nice, so she deals with billions. But what's really most important about it is the federal government has given the Commonwealth authority to integrate social services, and in particular, food insecurity and tenancy preservation, right? So for people who are housing insecure and food insecure within the waiver, which serves on any given day about 1.2 million Massachusetts residents. And it's really foundational change. Despite my good friends in Oregon who'd like to take credit for being the first, the reality was, not that we're competitive among states, but Massachusetts actually did receive the authority in the waiver that existed from 2017 to 2022. But there was another federal administration, won't name them, and it was almost impossible to get them to identify what would be allowable using Medicaid rules for food insecurity. So they gave us a pilot. And it worked, but it was a pilot. And what's transformational with President Biden, I know I'm a little long-winded because you can't talk about Medicaid in like 2 sound bites. I'm sorry. Senator C.D. DeMongo is probably like, oh gosh, could she just stop? But what's foundational with President Biden and his administration and my former Medicaid director who now works for him is that they acknowledge that you can't deal with health if you don't also fundamentally deal with the social needs that people have. And so it is a legacy for us. So for all of you who are advocates out there, you need to hold this administration, which ends in January, and the incoming administration to make good on really ensuring that the social needs part of this waiver are really fully implemented as core to the Medicaid program.
The announcement that you just mentioned yesterday is such a big deal because the folks didn't know, 80 cents on the dollar of healthcare spending nationally goes towards treatment of preventable diseases, right? How do we deal with preventable diseases? Changing how we eat, changing our lifestyle, right? And so the federal government acknowledging that food is medicine is a big deal. I bring my constituents to this discussion. I bring my family members to this discussion. I bring my aunt, who right now, has to battle between, does she take a few more hours on the job and then lose health care and her SNAP benefits for her 3 kids that she has, or does she take that extra 5 hours and try to make things work without the benefits? I bring that experience with me wherever I go because it gives me the urgency to not be complacent, right? I also bring with me the perspective that hunger isn't an issue that is just a subset of the population is experiencing, right? It's college students, it's parents, it's moms, it's kids, it's students, it's seniors. And in a state like ours where the cost of living is so high, food is oftentimes the first thing to go. And so that's sort of the lens that I bring to this work. I'm really excited to be here so I can continue to be energized. We were energized yesterday, but it was a long day and we're exhausted now, so you guys can bring us back up. And also to hear from you as to what your ideas and what your issues, what your priorities are, particularly for the next session. Right? I talk to my staff oftentimes. I say this time from now until January is called the gym, the legislative gym. When you think about NBA championships, they're not won on the day of the game, they're won in the gym when nobody's looking. And so we're in the gym right now, right? We're talking about what we need to do next session, what kind of legislation we need to file, what are the coalitions that we need to build, and how do we develop a movement so that we can actually end hunger here in Massachusetts.
I think if you get people in the room who have lived experience on both ends, so I've had the experience of, growing up, eating all organic, shopping at places that basically were niche places, and then going to food banks where I had to basically make meals with things that, I wasn't used to making meals with, but I could pull it together now. So being on both ends of that spectrum and offering that expertise, I think that's the value that I bring, and also bringing up children who are aware that food pantries exist, going to volunteer on their breaks at food pantries, handing out food, because we could be either on the other side of that door or on the inside of that door. And I choose to be on both sides of that door.
I represent a district, and there's no secret why Representative Vargas and I are working on these issues so deeply, because it affects the people that we represent every day, people that we see every day. And I represent the cities of Chelsea and Everett in particular, and also Cambridge and parts of Boston. But when you look at the pandemic and how it affected people, it's not a coincidence that it affected the people that were hurt the most prior to the pandemic. Environmental factors, food insecurity, housing crisis, all those issues that were there prevalent before were exacerbated during the pandemic, and now coming out of the pandemic, it's even worse trying to recover from that. And Chelsea at one point, and people might not realize this, New York City was getting a lot of attention in the pandemic as being the highest per capita infection rate in the country. That isn't true. At one point, unfortunately, Chelsea had the highest per capita infection rate in the entire nation. Chelsea, Massachusetts, people that I represent. The food lines were miles long. People that had to make choices of getting infected, waiting in a line, because they had no other option for getting food into their homes and to their families. And who knows how many people got infected waiting for food. But they had no choice. It was either that or not eating that day. So I come at it from that perspective where the people that I represent are hurting the most. And they need our help. And when you talk to people face to face, so you see what's happening in your communities, you're impacted by that. And what you're saying too about being just over that threshold of getting services. You know, Representative Vargas and I worked in universal school meals, and we look at that from the perspective of people that need our help, but outside world says the poor kids, you know, need that. No, there's the 20% of food insecure people don't qualify for these services. And now even more after the pandemic. So there's no threshold on food insecurity. And I get mad sometimes and upset when people say, you represent Cambridge and Boston, they need our help. There are poor people in Cambridge and Boston too. There are poor kids in Cambridge and Boston too. And when you look at it from that perspective, it's hard not to be impacted by it. It's hard not to feel that you have an obligation to step up and do something here. And I see so many advocates here. I'm not going to name names, but you know who I'm looking at on the right side over here, who's been working on that. And I will name Pat Baker, who's been working on this for generations. And being in D.C. yesterday, your name was mentioned by people, which was pretty amazing. You weren't there, but you are well known across the country for all the things that you do in this space. So it is our obligation, our responsibility. You know, we're sitting here today talking about it. President Biden is investing $8 billion into this. That was one of his announcements yesterday. And a lot of things, we'll go into other questions in the future, later on, but so many things that were happening that he wants to do nationally, we're doing here already. We're piloting here. So we should be very proud of that. But the work has just begun, because there's so much need out there. We have to keep going forward and making an impact on people's lives. And the only way we do that is by not talking, but getting down to work.
I think we also bring a sort of view of the sort of public-private relationships that have been mentioned. You know, we work very closely with the food banks, the 13 food banks across our footprint. We sort of, I'm on the board with Catherine that represent our company there. And all of our executives, I think, are on most of the food banks. We have an executive on each of those so that we get closer to what's needed and how we can help. We also have a sort of large number of suppliers that we work with and sort of trying to bring them on board. So everyone's trying to, they've got goals to do good and goals to advance things like hunger and other sustainability issues. But my view is always, if we can work together and pull, you know, the different groups together from, you know, the non-profits, our sort of industry, then you can actually make a much bigger difference. And that's what we've tried to do as we've worked with our food pantries that we're starting now 140. And so we bring that sort of perspective of, I think that's the biggest thing for today, is that public-private relationships and how we can make those work. Because there are a lot of people out there trying to do really good work. What's really surprising is when you actually sort of approach people to say, like, how can we work together? A lot of people sort of back off, and it's almost, no, actually, this is my kind of world, and I don't want you to come into it because that's what I do. So if that was, we could break that down, I think we could really make even more progress than we're making.
And while our Congress may not reach across the aisle, that doesn't mean that we can't, or that doesn't mean that we don't. And I think that Massachusetts is a leader and has so many things going in the right direction and can be representative of innovation and ideas. And my hope, I mean, I'm very hopeful. As I noted, I think I saw many, many new groups yesterday, people I've never heard of, that were chatting with each other. And it was terrific because it did move, you know, food bankers, I'll use it as an example, out of their silos. It did move legislators out of their silos. It did move, I saw, Andy, I don't know what group you were in the afternoon, but I'm like, am I supposed to, is that a Massachusetts group? And I'm like, no, it's not. It's some other group that you were in. And to be able to have that kind of forum yesterday for wherever it goes, the fact that, again, it was brought together, stood as an important issue for the Biden-Harris administration, empower states to cause and effect change, and to push as many of these federal nutrition programs forward. But we still have great leadership currently in our state. I believe out of the executive office, and we'll have a change of leadership, and I agree with you, Secretary, we have to keep that going. We have to keep that accountability. But if this isn't representative of where we're going, I mean, that's what I want you to see. That's the hope, is that these conversations and these relationships exist in Massachusetts already, you know, and Instacart will bring you in, okay, too. But I mean, that's just an example of others stepping forward in just an awesome way. So I'm very hopeful from yesterday, that we can cause and effect change and make Massachusetts food secure?
Given the announcements yesterday, I think we could take this in two ways, but I want to start with Gordon. You know, in terms of the food industry, what are the types of possibilities around collaboration that you see and commitments that the food industry is making?
You know, the kids' health meals at school are really important, are an important part of the legislation, because I think the ability for people to get fed, go home, have a meal, come to school, be able to concentrate, and education is the way that you can sort of, as Lisa said earlier, how do you take yourself out of some of these cyclical situations? And then I think the final one for us is that we'll need a lot of collaboration is this labelling element that came out yesterday. So again, trying to get all the retailers to agree to one standard is going to be a challenge. We've already got a sort of what we call guiding stars, very simple sort of process. It's a 3-star, so 3 stars for an excellent or healthy product, 2, and then 1 star and no stars if it's not healthy. And again, it just gives people the easy ability to walk into a store and understand if they're choosing a healthy option or not, and to make a difference. And so how can we get other retailers potentially working through that, or coming up with a system that really is easy for people to understand?
There were 700,000 people in that SNAP gap in the state of Massachusetts. And when you look at that number, and people just don't know where to access the benefit, they don't have time to access it, they don't even know if they qualify. So these people are working 2 or 3 jobs. They don't have time to go down and fill out paperwork, trying to figure out if they qualify for something that they don't know about. We finally have an infrastructure in place. And unfortunately, the pandemic came about, but it also created a system now in some of these communities where we can go at these issues a little deeper, a little harder, because we have more people involved in coming together on that. So
there's a really important role that we have to take, and we can't just expect that charity is going to fix hunger in America. On its own, it's not. But neither is government on its own going to be able to fix hunger in America. When I left the conference yesterday, I was trying to put different ideas and solutions that were either in the plan or that came up in our discussions into different buckets, right? Some of them we can do without Congress. Others, we're going to need Congress. Others are kind of state-related, things that we can do. But the longest list were things that we can do without any of them, right? That partnerships that can be created at the local level between school districts and the food manufacturers that are in my district, for example, or the farmers that are in my district. An idea came up yesterday. There was a little card on the table. I don't know if you guys noticed, that basically said that this was a food certified event in terms of that the food was going to be donated after the food that was left over, right? And one of the ideas that came up in our discussion was, what if we had a food secure workforce certification, right? That employers that wanted to ensure and show the world that their employees were not food insecure, that they were taking care of their employees, have a verification system for that to show that they're taking care of their own. And so there's just so many different creative ideas that are out there that, yes, we're going to continue to fight on the government side of things, but there's so much stuff that we just have to do through the partnerships at the local level, and it takes these kinds of conversations and discussions to make that happen. There's no Chef Jose Andres, right, World Central Kitchen. We met him at the end of the conference, and he said something that kind of stayed with us. We brought up to him that Massachusetts did universal school meals, and that we're one of the few states that extended it, and he was not impressed at all. He was like, "That's what you're supposed to do. You guys are Massachusetts. What do you expect?" And he went on to, on a more serious note, say, we've our expectations of government and a society have come down here, right? Providing meals for kids is such a basic thing that we should be doing, right? Shouldn't be something that we have this amazing applause for, right? It's a basic necessity that we need to meet as a government, and we need to think big again about the problems that we have in our society. And so I'm taking that with me. I'm taking that think big mentality that, yes, we're going to get universal school meals done, but what else, right? And concretely, action items for me, I'm meeting with my student nutrition director and my superintendent, and we're thinking about ways that maybe the state can incentivize that type of local produce and healthy products in our public schools. so that we can make it possible, financially possible, for school districts to do this, but also to give school districts the bandwidth to be able to actually go out into the community and develop these partnerships while they're dealing with the slew of other issues that they have before them. So those are some of my action items, but I still have to debrief. It was like 16 hours ago, guys. Like, this is like...
Yeah.
There's the fire right here in front of us, which is a reauthorization bill, for children coming up. And it's in the queue. So in terms of Congress, and I think, Senator, you mentioned it well, our delegation is voting fine on this. So where can you put your energy to make sure those other votes happen? Because I think there was a universal feeling out of yesterday that children mattered, the investment in children mattered deeply, and what were those pieces of legislations, either in your municipality, your state, or your government, your federal government, that could be passed. But the child reauthorization bill is right in front of us. That would be one. And the second is we are doing, the Farm Bill is coming up, which also has a huge part. And there were aspects in the Biden-Harris plan that could address that. And I think Jose Andres, again, he just breaks it down. If you haven't seen him on YouTube, or go watch that part, because it is inspiring about why we do this work and why we would take these risks and why we would fight this fight. And it is about the future and about that next generation. So again, my takeaway is listen to the individuals that with lived experience and what they have, and fight to change what we can. And right now, and to move those two bills forward in our congressional legislature.
And the big focus with us will be continuing partnerships, I think, and especially in our food pantry program. We have 140. We're trying to get up to 400, where we have 5 of our major suppliers working with us to provide food for kids as they go home in the evening and their families. So that works well. And I think then finding other relationships and partnerships. So we partner with Instacart and a number of things. We partner with a company called Flash Food that's just developed this year, where any product that's getting close to the end of its life, we actually put it in. We've put it in a sort of fridge. It goes on an app. People can come in and buy it probably at half price, and that again stops food waste and helps access. And then there's Fresh Connect, which is a sort of produce prescription program we've launched in Grove Hall here, and people who are in need can go to their doctor and get sort of a prescription for fresh produce. So we're partnering with those sort of things. So there's a lot of really good entrepreneurs coming up with thinking of good ideas, and it's in how do we help them join the dots basically, so that actually these ideas actually work, and you've got a place that you can go where we can fulfill that need. And I think that's one of the big challenges in the same way in government, where all the dots aren't necessarily joined. The same with some of these systems. If we all work together, I think we could really bring some good change.
This is too big of an issue to attack in one or two ways. Increasing cash assistance for people in poverty, right? So right now, if you can believe it, there are different levels of poverty. There's poverty and then there's deep poverty, which no one's living in poverty at all in this country, but just imagine families that are in deep poverty. And we have increased cash assistance the last 3 budgets with the help of so many people in this room, but people still need more help. So we need to increase cash assistance to families. Lifting the cap on kids. People actually thought at one point people were having children to get more money, if you can believe that. And there was a law in place that blocked people from having that could get more money because he had more kids, which we took that away. And universal school meals. If a child comes to school hungry, was mentioned, they're ready to learn. We've invested millions and millions of dollars, billions now, Student Opportunity Act, to give back to our schools. You can have the best schools, the best teachers, the best technology. Child's coming to school hungry, all that money is going to waste. And and when you look at the SNAP gap, closing that and trying to get more people on SNAP, this is how we make change. One or two things is not going to happen. The child tax credit that Biden was hyping yesterday. Please, just make common sense prevail here for once. And let's give people money that need money.
We don't know what we don't know. And I think a lot of times when people or legislatures put forth, what I learned from yesterday is that I would have never received that packet. I would have never looked at those different points. I would have never because I wasn't part of the conversation, but to bring us into the conversation and make it small enough for us to be able to take it out. So what I take away is that all of the services, I always tell someone else about it. If I know there's someone in my child's class that needs something, or I'm always going to try to be that resource, because if you don't know that there's a common application for SNAP, for Mass Health, if you don't know these things, you can't do anything about it. So I think by any means necessary, we need to try to figure out the things that we don't know.
There are certain issues like nutrition, right? It's just core. You can't learn. You can't work. You can't think. You shouldn't have to worry about whether I'm paying my rent, buying my pills, or buying food. It is just so core. It's just a fundamental core issue that it really should be core to all of our policies. And I think that's, that's what I take away, is you just go bold on it.
I don't think any of us said this on the panel, but we should be thanking the food bank as well for feeding so many people during the pandemic, and what you've done before and after that. You've literally sustained communities during the pandemic, and I know firsthand in my own communities, without the food bank, so many people would go hungry. So thank you very much for all the work that you've done as well.
Thank you.